As this new year opens, healthcare legislation has come out of the State House that promises to reduce some burdens that residents have had to endure in the pandemic. On January 1st, Governor Baker signed a new healthcare law that increases access to affordable care, promotes telehealth services, and protects consumers from surprising medical bills. The law extends insurance coverage in Massachusetts to cover COVID-19 testing and treatment. The legislation also allows Mass Health members easier access to urgent care sites without referral requirements, and it expands the scope of practice for advanced practice nurses. State Senator Cindy Friedman, who worked hard to pass the bill, joined ACMi to describe the impacts of the new law.
New provisions for COVID-19 is it requires all treatment of COVID-19, inpatient and outpatient, so no copays and deductibles, anything that is a result of contracting the virus. It also expands access to testing, coverage of testing, even for people who are asymptomatic.
The new law also mandates that telehealth sessions be covered at the same rate as in-person treatment, even after the pandemic, which is an important change.
Telehealth will have a huge impact on Arlington because that will allow people in Arlington to get access. In the behavioral health space, before we required telehealth to be accessible and covered, there was a no-show rate in the behavioral health space, people not showing up for their appointments. It was a huge number. Since telehealth, that number's gone down to less than 5%. So that means that people are getting the connection to their providers that they need. Scope of practice will provide more access to providers, and that will have an impact. And then I think the out-of-network will be very, very significant for the community.
Senator Friedman acknowledges that there is still plenty of work to be done in the area of healthcare and cites a few major issues that must be tackled.
We need to take the next step in out-of-network. We have to address the high cost of pharmaceuticals, and we have to engage the pharmaceutical industry in helping us solve that problem. And then I think another big piece is behavioral health. How do we increase the workforce so that behavioral health gets more focus and also people have more access?
As the pandemic continues to create stress and anxiety for all of us, we are happy to share a little good news, and we hope to have more to share in the future. For ACMI News, I'm Inyeong Kim.